Hey there, Dr. Brandon Bupp back here at Advanced Health and Wellness Center, and I wanted to give you guys some stretches and a couple of exercises. We're going to do this in a multi-part video series, but I want you to have these things so that you can see some things that you can do at home and some stretches and exercises that will help you to kind of deal with and manage some of the discomfort or pain that a person might be having. So one thing that's important to note is that these stretches are to help relieve or decrease some of the symptoms, but they are not going to fix the problem. And so I want to show you some of the things that you can do now. So the first thing is, if we're talking about lower back, so this is a lower back stretch, something that you can do at home. First thing we're going to do is bring this knee, the one leg is going to go down. We're going to bring the other knee up, grab it with both hands. Go ahead and grab your knee, and then we're going to bring it across to the shoulder. So we're bringing the knee to the shoulder, not the shoulder to the knee. So we're going to bring the knee to the shoulder and relax the upper body, and just try to let this thing kind of stretch as much as possible. So we do this for 30 to 45 seconds, okay? So we're not going up to the same shoulder, and we're not twisting the lower back today. This is for somebody who's in lower back pain, acute pain. We're just trying to get some relief. All right, so we're going across to the shoulder. That leg can go down. We can switch sides. And this one, we're gonna bring this up and across, same thing to the shoulder. So we're not going across, we're going more to the shoulder, okay? We're not going straight up to to the same side. We're going across to the opposite shoulder, and then we're just going to hold that stretch again, 45 seconds. We'll try to shoot for 45 seconds. If you get cramping or pain, stop. Let us know about that. Cramping a lot of times has to do with two things. Typically a magnesium or some other mineral deficiency, and a lack of water. So those are conversations that we need to have. Making sure that we're hydrated. How do you know if you're hydrated? Your urine is clear. And then also it can be a lack of minerals. So we're going to bring this other knee up, specifically magnesium. Bring these both knees, and the knees have to go wide and around the body, around the torso. So we're going to pull the knees up to the chest, kind of tucking our pelvis under. And if you have somebody that can help you, they just put a little pressure on your feet, and that will increase the stretch. Many of you won't need to do that. Just pulling your knees up is good enough. Laying on your side, if we can show that, Eric. So we're going to lay on our side and pull our knees up with both hands like a baby, right? Because this particular stretch, maybe we can't lay on our back. But this stretch right here will help to somewhat decompress the lumbar spine. And so same thing, we'd hold that 45 seconds. So then you're going to come back and lay on your back. Let me give you one exercise to do today. We'll kind of break this up into pieces. And so what I'm going to have Eric do is tuck his pelvis under, and then he's going to hold that for a count of 10, and then relax. He's going to tuck his pelvis under, hold for a count of 10. So we could do up to 10 reps, holding for 10 seconds. You could try starting out with that, but maybe we don't start all the way with 10 reps. We do 10 seconds and 5 reps. So all we're trying to do is tuck the spine under. He's pushing his spine into the floor, utilizing his core muscles, and at the same time he could do what's called a Kegel exercise. So that would be if you were urinating and you try to stop the urination, you would do a Kegel in order to do that. So you do those exercises called Kegels that strengthens the pelvic floor. One variation of this exercise, I have him come up on his elbows, all the way up to your elbows, bring these knees up, good. And he can do the same thing. So now he's going to, same thing, tuck his pelvis under. He's going to press his spine into the floor, and that will also take stress off the lower back. understand this again, okay? These exercises are not corrective. They're supportive. They're pain relieving, but they are not corrective, okay? If you find yourself with pain in any of these things, just stop. If it increases the pain, and then we'll go from there. But if you have questions, share this with your friends and family. Please let us know if you have any questions. These are some things that a person can do. But the most important thing to do for long-term corrective care is to get an x-ray and an evaluation and find out what's causing the pain in the first place. Hope this was helpful, and we'll see you soon.